Look at the front desk of almost any eye care practice today. You will see an endless loop of ringing phones and scattered paperwork. This environment burns people out quickly, pushing annual staff turnover to 25%. The primary force driving your staff to leave is the endless cycle of prior authorization requests. In this line graph, the flat line representing physician time diverges sharply from the steeply climbing red line tracking the administrative toll. An average physician triggers 39 prior authorizations per week, consuming 13 dedicated staff hours. Zooming out to 2035, shrinking supply falls 12%, while demand surges 24%. This 30% gap creates crushing pressure, driving staff burnout to 40%. Clinics are bleeding both capital and daily capacity on paperwork that contributes absolutely nothing to direct patient care. To fix this, practices are moving their specialized administrative workflows out of the front office and handing them to dedicated offshore teams. These are highly trained ophthalmology specialists directly embedded into your specific workflow, working exactly like an in-house employee. They connect securely to your existing electronic health record system, or EHR, using encrypted VPN connections. All the work happens on your servers, meaning absolutely no patient data is stored locally on their remote devices. The entire operation sits behind an enterprise-grade compliance framework. It includes rigorous HIPAA certification, SOC 2 Type 2 audits, and strict HITR-US alignment to guarantee data security. Integrating this dedicated layer of remote support turns your administration from a fragile, high-turnover liability into a reliable utility that simply works. A premium remote staffing model also incorporates AI-driven workflows that operate faster and more accurately than a standard human hire. This dynamic radar chart compares standard static scheduling against an AI-powered system called predictive scheduling. By analyzing historical data, the AI boundary continuously adapts to forecast volume patterns, ensuring staffing levels stay ahead of patient demand instead of merely reacting to it. Once tasks enter the system, smart routing instantly analyzes them. The system auto-assigns each authorization or scheduling request to the correct specialist based on their specific expertise and current workload. Before any task is completed, automated compliance checks act as a final safety net. They flag and correct documentation gaps before those omissions can translate into denied claims or billing errors. You are getting a comprehensive upgrade to your operational and technical infrastructure, ensuring every administrative task is handled efficiently. Choosing between the in-house model and an integrated remote team comes down to a strict mathematical equation. This ledger compares the fully burdened $60,800 cost of an in-house employee against a dedicated virtual medical assistant. The $1,800 monthly fee brings the remote total to just $21,600 annually. You achieve a massive 64% cost reduction, saving $39,200. Reclaiming that amount of capital for every single administrative role on your team dramatically expands your practice's profit margins and overall operational capacity. Deployment is rapid. Practices go live in just 48 to 72 hours, with an assigned team leader and a customer success manager taking over the daily oversight. The transition carries zero friction, no long-term contracts to sign, zero training overhead for your team, and absolutely no turnover risk. Stop paying the hidden costs of administration. Initiate a 2-week risk-free pilot today and test the remote model against your exact patient volume.